An MRI does not use radiation. It uses a big magnet and water to create a radio frequency and to help excite the atoms inside of your body to give signal back to the MRI machine. An MRI is another special way to create imaging to diagnose an injury or an illness. An MRI has been around for a long time and is slowly being upgraded. Knowing what an MRI is about and knowing what to do, especially if you've never had one done before, is vital. While becoming an MR tech, you need to know what an MRI is, why an MRI is important, and what goes on during the MRI, and what makes a technologist so important. I work every day as an MRI tech assistant. I have been for the last 3 years, and after doing research and talking to coworkers on it, it has made me want to pursue this career even more. First, I'll describe what an MRI is, then I'll explain why it's important, and finally, I will discuss what makes an MRI technologist important and what they do. While becoming an MR tech, you need to know what an MRI is and why they are important. Magnetic resonance imaging, also known as MRI, uses a strong magnetic field, radio waves, and a computer to create diagnostic images. According to radiologyinfo.org, where they inform and educate patients on radiologic procedures, physicians use an MRI examination to help diagnose or monitor treatment for conditions such as tumors of the chest, diseases, heart problems. They can even look at a fetus inside the womb of a pregnant woman. If you're having pain from a basketball injury or you have cancer, an MRI can help diagnose those conditions. It can show where your cancer is inside of your body and whether you have a meniscus tear. There are open and closed MRIs. According to RAI, Radiology Affiliates Imaging, where they offer support services for medical patients, a closed MRI machine takes detailed images of the anatomy inside of your body using a cylinder container. Also, the closed MRI is what gets better imaging versus an open MRI, where an open MRI was used to help patients who suffer from anxiety and claustrophobia. If you think about laying inside of an MRI machine, it can be very misleading. Think about laying in a tanning bed. It is kind of almost similar, but the outsides of it doesn't open and close, or the ends of it are stay completely open like a tanning bed would. It is also very important to stay still during an MRI, or you risk having to repeat the entire scan instead of just one image. Next, I will explain why an MRI is important, as well as what goes on during the MRI. Knowing what an MRI is about allows a patient to have education aspect of them, but it does not allow them to fully understand why an MRI is important or why their physician may be ordering it. It is important because your doctor can examine many parts of your body. According to radiologyinfo.org, there are many common procedures done to help with evaluating and diagnosing these, such as organs of the chest and abdomen, your pelvic organs, your reproductive organs, even if you have enlarged lymph nodes. An MRI is going to get more in depth than a CAT scan or X-ray would. An MRI is going to look more from your bone all the way down to your soft tissue and your nerve endings. Most MRIs are done on an outpatient basis. Many MRI procedures are also done differently depending on what type of procedure you're having done. According to radiologyinfo.org, the magnetic field is produced by passing electrical currents through wire coils. These coils can also be placed over top of you throughout your exam. These coils send and receive radio waves, producing signals detected by the machine. And these radio frequencies never come in contact with the patient. The radiologist can also study these images in different angles. During the test, you can expect different things, from the table moving, heating, and even a repetitive tapping or thumping noise, and that's when you would be giving earplugs or headphones to help block out that noise. Now you might understand more about what an MRI is if you've never had one, and why your doctor may be wanting you to have one, and what goes on during an MRI. but you should want to understand what the technologist does. I will explain why an MRI technologist is vital and what they do during the MRI exam. According to the U.S. Bureau of Labor and Statistics, the magnetic resonance imaging technologist examines patients and they also operate the MRI machine. Throughout your MRI, you may hear your MRI tech speaking to you, asking if you were okay and to remind you to hold still. There are many different job duties that an MRI technologist has. Again, according to the U.S. Bureau of Labor and Statistics, the many jobs that a technologist has is adjusting and maintaining imaging, also the equipment, and they also prepare patients for the procedures by getting a detailed history, keeping the detailed history of the patient, injecting patients with the contrast media. Not only do they help run the MRI scan, they also help start IVs on patients or using a butterfly needle to inject that contrast media, also known as gadolinium. The gadolinium is also used for patients who may have a cyst, history of cancer, or if they could be looking at a lump on your finger, just trying to figure out what it may be. First, I described what an MRI is. Next, I explained why a physician may be ordering an MRI and what goes on during the MRI. Finally, I discussed why a technologist is important. Well, being an MRI tech, you need to know what an MRI is and why they are important, and what an MRI technologist does and what their role is. MRI isn't for everyone, especially if you're claustrophobic or the noise may bother you. An MRI is a very great way to get to the downwards of diagnosis, such as cancer or Crohn's disease. The MRI process can be very lengthy, so take your time and appreciate the technologist the next time you have any type of radiologic procedure done. Thank you.